Thank you. Good afternoon. Can you hear me?
Yes, good afternoon, Lucy.
Good afternoon, everyone. I would like to officially welcome you to today's session. We will be covering emerging trends in pharmaceutical supply chain management and career opportunities for young professionals. So we are very excited to have you with us today. We hope that this will be a session where you can be able to learn, engage as well. If you have any questions that arise during the presentations, please feel free to use the chat or wait till the tail end where we'll have a Q&A. But as you've noticed so far, your microphones and cameras are muted. That is just to avoid any disruptions during the session. And we hope that it will stay like that. If you have any questions, feel free to use the chat. And I would also encourage us to use the chat to introduce ourselves, maybe tell us where you're joining us from, and share maybe your LinkedIn, and we can be able to connect more even after this session, because this is not just a learning session, but also an opportunity for us to connect. Please note that for participants in Kenya, this webinar is CPD accredited. So please make sure that you subscribe to it on the PPB portal. And I think with that few said, I will just hand it over to my colleague, Juliet, who will be able to introduce us to the organization, who we are, what we do, and why we do what we do. So Juliet, over to you.
Thank you, Dr. Lucy. Good evening, good afternoon, good morning from wherever you're joining us. My name is Juliet Wauma. I am the Programs Assistant at African Pharmaceutical Network, and it is a pleasure to have each and every one of you join us for this conversation at a time such as this. So quickly, I'm going to take us through the overview of our organization, what African Pharmaceutical Network is, and the kind of work that we do. So most of us, we have been privileged to interact with APN, some not yet, but this is the opportunity. So African Pharmaceutical Network was established in 2020 amidst the COVID-19 pandemic out of the desire to address specific challenges faced in Africa's pharmaceutical industry and in its healthcare systems. This is cognizant of the unrest that was caused by the pandemic all over the world, and we are aware of the kind of impact and the havoc that the COVID-19 pandemic wreaked during the time of 2020, that is from 2019 December to 2020 and to 2021. And during this time, the impacts that were seen in the different regions of the world, Africa was not exempted. During the pandemic, the limitations of Africa's pharmaceutical systems are exposed. These are limitations such as weak regulatory systems, limited local manufacturing, and weak capacity in our healthcare systems. Something else that was also included was the enormous challenges in our pharmaceutical supply chains. Those are the barriers and the challenges that we face within the industry. With all this in mind, African Pharmaceutical Network was established as a network. Sorry, was to build the next slide. So with all this in mind, African Pharmaceutical Network was established as a network that brings together pharmaceutical professionals, stakeholders, organizations working within the African pharmaceutical sector for three purposes. That is knowledge sharing, policy shaping, innovation nurturing partnerships that lead towards a robust pharmaceutical sector, which is anchored on reliable access to safe, efficacious and affordable quality medicines and pharmaceutical services for the African people. The background that led to the development of African Pharmaceutical Network was limited local manufacturing capacity within the continent. And we know that statistics have already shown that Africa relies on importation. This is up to 70 or 80% But what we ask ourselves is that how be it that until now we haven't been able to change these narratives and also change these statistics, because this has been an ongoing conversation that we are working towards increasing local manufacturing, but still most of our countries continue to rely on importation. But we have seen various countries that have actually made an advancement to increase manufacturing within the continent. And some of these countries that are usually ranked amongst some of those countries that are enhancing local manufacturing, we have South Africa, we have Senegal, we have Egypt in the continent. But we are saying that we can also participate in this kind of work and improve local manufacturing within the continent. We also had segregated continental pharmaceutical industry operations. And this is a case where you ask yourself as an individual, if I am working in the supply chain sector, how am I aware of the policies that are able to affect the supply chain work that I am doing within the industry? Am I in a position to understand some of the quality assurance that will actually impact my product before I bring it to market? You find that those who are working within regulatory affairs are more aware of what is happening in RA, and others are less aware of what is happening within that kind of space. But here we are saying that we can come together as the industry and get to know, even with the different kinds of sectors that we have, that we can work together towards a common thing. Because when we come together, we work together towards a common goal, and that is access to safe, quality, and efficacious medicines. And then there was also a lack of a common platform to drive industry-led continental agenda. And this is what we offer as African Pharmaceutical Network, that we can bring together professionals, we can bring together organizations that are working within the industry in the African continent so that we can drive the agenda that we have. Let it not be that we have those who are not working within the industry driving the conversation. We are the ones who work in the industry, therefore we know the challenges that are in the industry. And if we know the challenges, therefore we know what are the solutions that we are looking for. And if we know the solutions, therefore we are able to work together towards these solutions. So we need to know, where do I come in? How do I come in? And whom do I approach, so that we can have that conversation and get to find solutions and initiate them, so that we may ensure that Africa continues to have access to medicines. So with that, our aim is to foster continental knowledge sharing and workforce development within the pharmaceutical industry. You are as good as the person doing the job. The job is as good as the person doing the job. Because if the person is not skilled, if the person is not empowered, then definitely you're going to have a shoddy job. Therefore, with us sharing that knowledge and empowering our workforce, therefore we know that we are going to have a better pharmaceutical industry. Then the second thing is to promote best practices and stimulate innovative models of service delivery in the pharmaceutical industry. We know that the kind of work that we do impacts life. You can make one simple mistake and it will affect someone's life. It could change their lives forever, or worse, it could even lead to the loss of life. But if we have best practices and we continue to stimulate innovative models of service delivery within the industry, then we will be making a better impact within the continent. And then we have the third thing, which is to champion for responsive, market-driven policies and regulatory frameworks in the African pharmaceutical industry. Every industry has policies, but we know that there are some policies that can hinder advancement within the industry. There are some policies that hinder business. There are some policies that will hinder that same local manufacturing that we are working towards to. So we need to ensure that we have responsive and market-driven policies within the African pharmaceutical industry. Then we also working towards stimulating investment within the African pharmaceutical industry. The industry is within Africa. We need to have the investments coming in Africa. But if the investment is coming to a place where we have not yet cultivated an environment where investments can thrive, then we should not expect so much. But if we can stimulate investment within the industry by ensuring that the environment that we have supports the investment and business, then we are working towards a great thing. So these are our priorities. We have pharmaceutical workforce development, which I have already spoken about. Then we have the business ecosystem support, where we know that we are working within a system. None of us can do the things that we do without the help of the other person, without the help of the other sector. We all rely on each other. And when we rely on each other, there are particular services that maybe you may not have, that person B maybe has. Therefore, what do? We ensure that that kind of support that you do not have, you have a way of ensuring that you get that support so that you may be able to achieve your mission. And this is where we come in as a network, that we, with the resources that we have and the capacity that we have as APN, we offer business ecosystem support. And which kind of services are these? We have regulatory services, we have clinical trial services, we have pharmacovigilance services, and market intelligence. We offer all these kinds of support to those who are working within the industry. And then our third pillar is policy shaping. We make sure that even as we are working in this place, the policies that we have, that the industry has policies that are able to stimulate business, they are able to stimulate innovation and the growth of the industry. Without these policies, we cannot continue to function as an industry. And these are policies that actually keep everything in shape. We make sure that the medicines that we are producing and circulating, that these medicines are safe, these medicines are of quality. It is because of the policies that we have. How do we do this? We do this kind of work through industry discussion forums, such as the session that we are having right now. We also do this through training and experiential learning opportunities. We continue to offer this through policy advocacy and environment shaping, market intelligence, and technical support to stakeholders. So this is our team. The organization indeed does have a team. We have an advisory board. We have a secretariat team. I am under the secretariat team, and Dr. Lucy is also part of the secretariat team. And then we have the leadership team under the able hands of Dr. David Odhiambo, who is our curator, and the rest who are also working with us within the same area. Who are our partners? We have FIP, IFPMA, H3D Foundation, Bloom Public Health based in Nigeria, Empower Swiss based in Switzerland, African Pharmaceutical Forum, Reculture Limited, and the SPAC. Our geographical footprint is currently on 25 countries within the continent, but we have been able to actually also have our footprint on countries that are outside Africa, such as the British Virgin Islands. We have our footprint in Switzerland. We have also had our footprint in the UK. So our offering, the pharmaceutical workforce development. And the reason as to why we are here this afternoon is because of this one pillar, so that we ensure that we grow Africa's pharmaceutical industry with qualified, competent, meaningfully engaged professionals within the pharmaceutical industry. As I said initially, the work that we do, it can only be as good and successful as those who are doing it. So we must ensure that our workforce is qualified, our workforce is competent, our workforce is meaningfully engaged. If all these are in place, then we can be sure that the industry is going to be a better place. And how do we ensure that we are achieving this? Through training. We have a pharmacy academy that was established in 2023, and we are offering right now 3 courses, that is regulatory affairs, pharmacovigilance and patient safety, and pharmaceutical supply chain. And this particular webinar that we are having this afternoon is courtesy of the pharmaceutical supply chain management training, so that we continue to learn. And then we also have workshops and industry discussion forums where we continue to engage conversations there. When it comes to other trainings, we have trainings that are customized and workshops that are also customized to different organizations depending on their needs. So once an organization maybe approaches APN with a need that we would like you to train our professionals on a particular area, we will do a research and get to find what are the needs of your organization. And then we will customize a training that best suits your organization so that you have a workforce that is well skilled. So these are the courses that we have: regulatory affairs, supply chain training, and the pharmacovigilance training. And all these are usually in session in each and every year. But right now for 2024, we are wrapping up, and the next offerings are going to be in 2025. So this is the course that we have. And up to this point where I have reached, I won't be speaking so much about it, but I know before we end the webinar, we will get back to it just in case there is anyone who would like to participate in it. So what would be next for you? You could become a member of APN, you could partner with us on the projects that we have, or you could learn with us. And with that, I have come to the end of my presentation, and I would like to hand over this session back to you, Dr. Lucy. Thank you so much.
Thank you so much, Juliet. I actually realized in the excitement of learning, I forgot to even introduce myself. So my name is Lucy Machocho, and I'm your moderator for today. So as Juliet has mentioned, or rather given a brief background on how all this relates to what we are doing. So the pharmaceutical supply chain is undergoing significant transformation, driven by several factors such as technological advancements, changing consumer needs, and as well as global challenges. And we are gathered here today to find out how all of these ties to how we can chip into these spaces. So if you look at global challenges, my colleague has been able to mention some of these challenges. With the example using the recent pandemic that she's mentioned. So the vulnerabilities of the supply chain were actually exposed, and there was need for resilience. They still need for resilience, because if you look at the COVID-19 era, due to the lockdowns and the social distancing, even the manufacturing industries themselves had to lessen the employees, meaning production capacity was also lessened. And there was actually increase in demands for health products, particularly PPEs and those used to treat the disease itself, so antivirals and antibiotics. And then if you look at the over-reliance on importation, you will find that most of the African countries actually rely on importation, 70 to 90%. And most of the importation is from countries in Asia. So if you look at a country like India being able to supply the product all the way to an African country, there are several middlemen that are involved, meaning there's high potential for the products to actually be tampered with. This includes the quality. And that's why there are actually high rates of substandard and falsified medicines in Africa, with 1 in every 10 products being substandard and falsified. Because you'll find that when the product, say, leaves Gujarat, it has, before it gets to Kilindini Harbour, it has encountered different middlemen, and before it leaves Kilindini Harbour all the way to maybe someone in Diana in Kisumu, it will have encountered different middlemen. So in that process, how are we able to ensure that the product that actually reaches the consumer is what was actually dispatched from the manufacturing facility? So technological advancements have been able to enable us to do this, and we are going to learn about this today. We will navigate, as we navigate these complexities, how do these trends shape the supply chain landscape? They are enhancing operational efficiency and as well as creating exciting opportunities for us young professionals. So today, Pamela and Dominic will take us through how you can position yourself to seize on these opportunities. And I will quickly introduce them before I give them the floor. So I'll start with Dominic. So Dominic is the executive manager of the People That Deliver initiative. She is a strategic and relationship-driven manager with a passion for delivering meaningful impact. She's an international development professional with 25 years of experience. Since 2016, she has been responsible for the management and overall performance of People That Deliver initiative, a broad coalition of organizations working together to raise the profile of the health supply chain workforce as a key strategic area of health systems. Prior to People That Deliver, she worked for 10 years on the HIV/AIDS supply chain at the Partnership for Supply Chain Management, which procured and delivered essential life-saving medicines and related commodities to HIV and AIDS programs around the world. Our next speaker will be Pamela. So she is a supply chain expert from Kenya, specializing in improving access to medicines in Africa. She has over 30 years experience and has worked for several organizations, including Oxfam, UNFPA, and UNICEF, and now leads her own supply chain consultancy, Pamela Steele Associates. She holds an MBA in supply chain management from Leicester University and is a guest lecturer at several European universities. She's an executive committee member of the Reproductive Health Supplies Coalition and is a member of SIPS, SILT, and ASCM. Pam is a proponent of gender equality and recently began an initiative called Girls on the Move to encourage more young women to work in the supply chain. So I will quickly hand over the floor to Pam and Dominic. The floor is yours.
Thank you, Juliet. You have the slides for us?
Yes, the slides are coming up.
Okay.
Let me know that you can see my screen.
Yes, I can see your screen.
All right.
Thank you. Thank you, Juliet. And Dr. Lucy. And thank you so much for giving this opportunity to myself and to Pamela to present on behalf of our organizations to the African Pharmaceutical Network. I really appreciate that. So let's go to the next slide. And I think let's also maybe let's pass this one as well, because we've already been introduced. So to the next one, and that will be over to Pam.
Right, thank you very much. I've been introduced, and now I'll say just a few words about my company, Pamela Steele Associates, which is a supply chain management consulting company focusing on education. We run a PSA Academy where we again teach all the key supply chain topics. We also have an interest in decisions based on facts, so we do research. And we've been working in developing context in-country supply chain assessments, and also a strong focus on workforce capacity development. As I think one of the points that Juliet raised was, you are as good as the person working on the job, or the job is as good as the person working on it. So very important that we focus on workforce capacity development. And this is where we link very well with the people that deliver. That is an initiative that leads matters to do with workforce. And I hand over to Dominique to talk about the people that deliver. Thank you.
Thank you, Pam. Next slide, please. So wonderful. Yes. As Dr. Lucy mentioned, I am the executive manager for People That Deliver. And so I represent this coalition, which is made up of 34 organizations. Pamela Steele and Associates is one of our active coalition members. And basically, this coalition is made up of like-minded organizations that are all working towards strengthening the capacity of the health supply chain workforce. At the same time, also promoting the professionalization of the supply chain role within the health system. So who are these people then that we are supporting? These are all those people that are collectively tasked with ensuring the availability of appropriate commodities and managing the forecasting, procurement, storage, distribution, and proper use of health products. So People That Deliver was established in 2011. So we've been going on for quite a few years now. And we were originally set up to advocate for a systematic approach to human resources for supply chain management. We, as a coalition, we build on the experiences of our coalition members to advocate for this change at global and country level. And this really results in a stronger and more sustainable system for developing, recruiting, and retaining a qualified health supply chain workforce. And you'll see here on this slide then all of the different organizations that are part of the coalition, and they cover the important donors that are providing funding to this space, to a lot of the technical organizations, NGOs, academic and research and training institutions, as well as professional associations that are supporting workforce development. Next slide, please. And so just wanted to highlight here that we are the global technical leader in human resources for supply chain management, and that we are the conveners, leaders, as well as the advocate for health supply chain professionals. Next slide, please. Thank you. And so what we do is accurately depicted here in that we convene diverse organizations, so those 34 organizations that are part of our coalition, as well as we work on multiple programs with many diverse stakeholders, especially also at the country level. Number two, we develop supply chain management leadership capacity. We believe that building this leadership capacity is very critical to supporting the national supply chain systems. We engage in advocacy, so global and local advocacy. And then at the heart of a lot of the work that we do is creating tools and frameworks to support the building of the workforce in supply chain management. Next slide, please. And so this is our sort of third strategic enabler of our new strategy. And basically, I just wanted to highlight here that we have a few critical tools and frameworks that we base all of our work on. And I would like to suggest that you visit www.peoplethatdeliver.org, and you'll find more information here on our Building Human Resources for Supply Chain Management Theory of Change. It's a way of looking at building this significant workforce through the lens of investing more in the areas of staffing, skills, working conditions, and motivation. The other critical tool here that I've listed is the Supply Chain Management Professionalization Framework, and I will speak to you more about that in the coming slides, as well as our work-based learning toolkit, which we believe will be very useful and practical for you as you undertake your careers in supply chain management. This work-based learning toolkit is going to be published in the coming weeks, and once more information is out after this lecture, we can provide you a link to the work-based learning toolkit. So now I think please go to the next slide. Thank you.
Right.
So I'm gonna pass it on to you. Pam.
Thank you very much, Dominique. And it was interesting listening to the scope of work or the objectives or the goals of the APM, because some of the things that you are saying as the reason for your being is touching on what we are talking about today. It's about developing a strong pharmaceutical sector. And I think we have folks here who do understand what supply chain is, but just for purposes of having a common understanding, I would say that, in defining pharmaceutical supply chain, we all understand that it's all about coordinating and managing the information flow of the product right from the source to the point of use. As simple as that. If it's not reaching the end distribution point, the service distribution point, right from the point where it has been manufactured. And again, you know, Dr. Lucy talked about the multiple handling that happens along the way from the source to the point of use that can or are often affect the integrity of the medicine, the potency of the medicine, that we have to make sure that that supply chain is managed by professionals, people with the demonstrable competence to really manage supply chain. I think we cannot sit and see non-supply chain qualified managing supply chain. As someone mentioned again, I think Dr. Lucy, that all these failures can result in serious impact, and the worst of it is loss of life. And we don't want that as pharmacists, pharmaceutical practitioners, and all health workers to have blood in our hands because we did not do our job well. So very important that we have that common understanding. The second one is the need to understand that you know, there is quite a lot of volatility. I think, again, Dr. Lucy alluded to that, or was it Juliet, talking about the COVID pandemic. Today, it's not just the COVID pandemic, and now we're talking of the mpox. We do not know which other emergency health disaster will face us. But it's not just the disease outbreak, it's also about the geopolitics that we see all around us. And all those disrupt supply chain. And as Dr. Lucy said again, that 70 or 80 to 90% of African medicine comes from China, from India. Let's put it, I did some research early on at the onset of COVID, where we found out that only 350 manufacturers of drug exist in the continent of Africa, of which is serving almost over 10 billion population. While in India, we are talking of some 10,000 plus, and China has 5,000 drug manufacturers. So Africa has still a lot to do. By the way, those 350, majority of them are in Southern Africa, and the rest are up in the north in Egypt or Morocco. But within Sub-Saharan Africa, we have a big challenge. So talking of local manufacturing, then we have a challenge. And that leads to the challenges that, again, Dr. Lucy alluded to, that it's not just those external challenges that we face because the world is globally connected. It's also the reality today. You know, we lack proper infrastructure, lack of properly skilled personnel. You know, it's lack of resources, lack of funding. We still depend on donors. And you're talking of local manufacturing. One of the reasons is because we lack the active pharmaceutical ingredient. How do we build that capacity? But also safeguarding the integrity of the medicine, because you talked about things that can happen before the product reaches our shores. But even within, how do we make sure that regulatory frameworks are strong? So that's very important. So that links to the third point on the challenges of low income and developing countries. Next slide, please.
Okay,
and over to you,
that's
Dominique.
Yes, thank you. So why are we here? And no, next slide, thanks. Yeah. We are here today to talk about this very important topic, and topic that, as you can see, Pam and I are both very excited about. But at the core of this is that there is a global health workforce shortage that's projected to be 10 million by 2030. Okay, so that's the premise of it. We also are here to talk about human resources for supply chain management. And why do we do that? I mean, when a third of the world's population is not able to access medicines, and there's a lack of human resource in many areas of healthcare, then why just specifically human resources for supply chain management? And so for us, we have some big reasons for that. First of all, something that I'm always make sure that everyone understands is that supply chains are a key enabler for all health programs. And so you may have heard others speak to this, but this aspect, this tagline of no product, no program. So if you want to have an efficient health supply chain system, which is essential for achieving, global health goals and local health goals, such as reducing child mortality, improving maternal health, combating diseases like HIV/AIDS and malaria, then you need well-functioning supply chain management systems. And if those systems fail, then the consequences are, of course, stockouts of critical medicines, expired drugs being delivered, and of course, vital equipment that is failing at clinics. And so who then is important in this, of course, are the workforce that supports the well managed health supply chains. We also know that health commodities must reach service delivery points and patients through very long and complex supply chains. And of course, any weaknesses along those very complex supply chains can result in shortages. And of course, those all affect health outcomes. And so in the end, really, it's all about having the right people with the right skills, running those supply chains. At the same time, we need these people to be supported by appropriate HR policies. We also need them to be supported by good supervisors that monitor them, that help them to keep them motivated. And so this is really at the core of it for me.
And Dominique, let me just add also
of course,
there that
jump in. Yeah.
We're talking of 2030, but the problem is acute today. We're talking of health workforce shortage, but we're not. If you link this to the growing disease situation, whether it is life change of lifestyles and whatnot, we're having more diseases today than before. Whether it is cancer, whether it is diabetes, and all that. But there's also the shrinking donor support. I mean, donors have also their problems at their doorsteps. And yet we're sitting here, perhaps thinking of what it will be in 2030. But the problem is as urgent as yesterday. We have a big problem. Dominique, we did some studies here looking at the labor market itself. Now, we have a big youth population that is unemployed or underemployed. And yet we are saying that we have lack of skilled workforce. What can we do with the youth that are jobless in our doorsteps and be able to help address this problem?
No, absolutely. We know that right now, this is the largest global youth population in history. So there's about 1.2 billion individuals between the ages of 15 and 24. But what's significant of that number is that 85% of those young people live in low and middle income countries where there are employment challenges. And specifically, when we think about supply chain management, there is a skills gap. And there's a skills mismatch, which then I think is really important that stifles innovation and adaptation within healthcare systems. And it makes them less responsive to new challenges that you just mentioned around the emerging diseases and, of course, these demographic shifts. So what we need to do here is really align the capabilities of young people with the demands of health supply chains and offer a very unique opportunity to address both this unemployment issue as well as this issue around this skills mismatch that we're seeing. And of course, so what we have within this lecture for you is some suggestions to solve this problem. So I think let's go to some of those suggestions. Next slide, please. And so I think that's where we then speak about these technological advancements. So I just wanted to highlight to you some of the supply chain innovations and trends for 2024 and the technologies that are becoming a priority in the supply chain industry, which are all very exciting, but at the same time, we need to be ready for them and we need to build the workforce to be able to manage these. And so number one, of course, artificial intelligence is on the top of the list for everyone. It's interesting to look at AI because, AI can analyze operations, and plan process improvements, even thinking about when you think about like transportation management, it can optimize routes for faster and more economical movement of goods, which is really important for the supply chain. The other one, of course, is the Internet of Things. We can have these devices that can monitor temperature and humidity and light intensity. And of course, the wearable devices that can deliver all kinds of data to us. So these are some, very key critical innovations that we're seeing. Of course, there's big data analytics, there's robotics, there's the aspect of supply chain sustainability that Pam will speak to you about. And the adoption of environmental friendly materials and processes within supply chains. There's also this especially for the pharmaceutical supply chain, this area around supply chain traceability, to be able to track goods from source to patients, so that there's an overall control within the supply chain. And it also, of course, facilitates sustainable practices, and of course ensures that the safety of the products, and that they're qualified products. And of course, then the very last bit is the last mile delivery. So, what we're seeing is that final step in the journey of pharmaceuticals to patients, where, of course, we're seeing a lot of use of drones to transport items very quickly. So now I'm going to pass it on to you, Pam. You're on mute, Pam. Sorry.
Yeah, thank you very much. Sorry about that.
Yeah, next slide, please, Julia.
And let me just say here that we like it or not, we can sit in our corners and think that it's not yet reaching us, but the reality is here. I mean, it's almost 6 years ago when I was asking myself, drones, who will allow the drones to even fly? A common object on the airspace. Here in Kisumu, we have the zip line trying to distribute medicine using drones, and that has been going on. Rwanda, it's going on very well in Ghana, in Nigeria, where I used to work. So some of these things are happening to us today. You like it or not, we have more intelligent patients. I don't want to call them customers, but we have more intelligent patients who demand to know when their product is going to arrive, when their medicine is going to arrive. If any pharmaceutical organization today exists and has not integrated its supply chain, then it is saying to itself that it's not rather in business. So digital transformation and technological integration is critical. You're talking of those ability to anticipate needs, coming with the data analytics. Amazon today is ahead of the game because it can anticipate the client's needs, and not just anticipate it, but also deliver it within hours. I think I've been in the UK where within hours you receive what you ordered in the morning. Why can't that happen with medicine? Dominique is talking of last mile challenges. How can, and this is where we can leapfrog, that we don't even have to follow the same path as others, but leapfrog. This is also the country of innovation. If you know what we've done with our technological transformation, digital transformation, rather with the M-Pesa system. You're talking again of blockchain. Is another area that we have to consider. That aspect of transparency is key, so that you're able to know where your product is at any time on the high seas. Has it landed on the shores of, on your port of entry? Is it in the warehouse? Dominique talked of the Internet of Things, those wearables, but mostly the temperature measurement devices that will help you track the status of the inventory in the warehouse. There is quite a plethora of technology at our disposal, but we just need to know which one is relevant for us. and prioritize that accordingly. And, again, you talked of regulatory aspects. When we are talking of local manufacturing, I think for me, the biggest fear here is how we'll be able to regulate the market and be able to protect our porous borders, which you know very well that currently open. I mean, anything can come and go. So really increased regulatory compliance and quality assurance is one of those areas that we will definitely need to get into. And then, of course, there is the green supply chain. We cannot sit back and say that, we will want it the way we want it. We have to demand from our suppliers more. I think I read early this year that within the European, I think it was Germany, that came up with those strict regulations on protecting the environment, particularly with sourcing of commodities. They are tightening the rules, and I think the more we can take advantage of that to be able to trade with others. Because again, you're talking of this local manufacturing. If we're looking at doing it in a scale, Kenya alone cannot succeed with its own local manufacturing. We may have to regionalize this aspect of local manufacturing, but then call it regional manufacturing. But then you will consume, but you also want to sell more. But are you complying to the international regulations or even your own national regulations? Those are questions we have to ask ourselves. Next slide. Right, and perhaps I've already touched on these aspects, the role of AI, the role of blockchain for transparency, and the Internet of Things. There's very good examples of successful digital transformations in supply chain. I can mention companies like, I mentioned Amazon, but Amazon is more for the general products, although it even wants to get into health. But Pfizer and I'm sure Merck and Johnson & Johnson, these are health organizations that are right ahead and are reaping the benefits of digitalizing their own supply chain operations. And then the need to have data to drive decisions. I think we are beyond the era of being driven by intuition, that I guess I know, it shall, it's more of what is the data saying, but that data has to be collected in the right way, has to be collected real time, it has to be clean, accurate data for you to be able to make the right decision with it. Next slide. And I touched on the sustainability and green supply chain management. We are currently involved in a project funded by the European Union focusing on waste management in field hospitals in humanitarian settings. And what you will, appreciate is that, talking about waste when it has been, discarded out there, littering the compound is not the real thing. This is all about applying your green supply chain management approaches right across the supply chain end to end, from the point of sourcing it to the packaging, to the shipping, to reduce carbon emissions, to the point of use, and the kind of packaging that we are using. Are they biodegradable? But also, and if they are not, how are they disposed of? That is critical. Unfortunately, today, if you look at the study we have carried out, you would be shocked at how sad the situation is. But it's not only about waste management. It's also about the transportation modes that you're using, the transportation routes that you are taking to minimize carbon emission, the packaging aspects, and I think supply procurement as a gatekeeper. Procurement is key in all these aspects of sustainability and green supply chain management. So really, if you're working in procurement, then you need to know that you have a key part to play. But it's, again, everyone's responsibility. So, and as I said, many of these health companies, manufacturing companies, are somehow ahead of the game. The Pfizer's, the Merck, Johnson & Johnson have very good examples and a lot that we can learn from, because we cannot just look at aspects of local manufacturing that we want to do local manufacturing, but we are not looking at the whole, we are not taking a holistic approach as to what does it really mean to comply with those international but also local regulations. Next slide, please. Right, and again, more of perhaps a repetition here that we need predictive analytics for inventory and demand management, no longer the intuition-led decisions. We need to optimize supply chain routes and reduce costs. That is how you achieve your green supply chain and promote sustainability. Of course, there are case studies, and again, I would cite the few advanced companies that are already ahead of the game. I don't know which companies I can cite locally, other one, the principal, the agents of the international companies. I don't know how much they adhere to that locally, but I know that internationally that some of the companies in the supply chain. Next slide, please. Right, so over to you, Dominique.
No, I think you were going to answer this one.
Okay, yeah, so let me do that. This is very, very easy, to answer. The answer is no. Do students leave education with skills required for supply chain management? I can tell you no. Why am I saying that? You'll be surprised. I've been a supply chain practitioner for almost 30 years. And I have taught supply chain. I've come across those who sit in front of me with PhD in supply chain, and some of them, when you ask them to define supply chain, what supply chain really means to them, then you really struggle. And that goes back to the quality of education that they will have received. So today we are struggling to have the right people. And this is why, and this is something that can also affect employers when you send them someone with a degree or a PhD and cannot deliver, while someone who has been taught the technical skills and open to learning is able to do things better than someone who comes with qualification. And we've seen that. We've seen where sometimes the paper doesn't count. But what we can say today really is that the quality of education is substandard. I'm saying that without any apology, because I've come across a huge number of people who disappoint me. I'm a supply chain company. I recruit globally. And when I see people come to me and with qualification and they don't have the competence, they are not able to articulate themselves, then you feel so sorry for the students themselves, because they paid money. And then you're going to an interview where you cannot even present yourself and market yourself as someone who has got the education. So the students today do not live with the skills required for supply chain management. Part of the problem is not the students, by the way, is the institutions who perhaps are teaching. Those who are teaching don't have supply chain knowledge, or they're a product of the kind of supply chain education they received, have no practical experience, have never worked in a warehouse, do not know how a forklift looks like, a pallet rack look like, but they are there in front of you delivering supply chain knowledge to you, more of a textbook approach. And then the sad thing is that they don't even engage with industry to be able to give these students an opportunity to go and get some practical experience and sort of translate theory into practice. Dominique, I don't know if you have anything to add to this.
No, I think you've covered it pretty well. I'll cover the next portion.
Thank you.
Yeah, so let's move. I think we can move to the next slide and then to the next one. So, and then just one more. Perfect. So then the question is, how do we prepare for the supply chain management workforce of the future? I think this is really core at the lecture here today. So what we need to do specifically to prepare the workforce is we need to attract more youth to the profession. That's really the issue. And then we need to retain youth once they join. And then we need to ensure they develop skills that are needed to run the health supply chains. So investing in the development and integration of young people into the workforce allows many African countries to address the critical gaps in their supply chains, reduce the youth unemployment that we've talked about, as well as set a foundation for continuous economic improvement, as well as social stability. I think, those are lofty goals, but they can really help with that. So this approach not only benefits the health sector, but contributes broadly to national development goals. So I'd like to introduce then our supply chain management professionalization framework, as well as our work-based learning toolkit, and then talk a little bit about what supply chain organizations and academic institutions can do, as well as what young professionals can do. So next slide, please. So unfortunately, what we've seen is that there is no global standards for health supply chain management professionals. And in many countries, we've seen also that there's no difference between supply chain management professionals that look after medicines, pharmaceuticals, and health commodities, as well as other commodities. And so what we see often is that professional associations fill the role of setting practice standards for professionals where regulation and/or registration does not exist. So what we've done is we've worked with many global key stakeholders to develop a supply chain management professionalization framework, which was introduced in 2020. Let's say at the height of COVID, and at the same time as your network was also created. And so what we want to do with this professionalization framework is establish and standardize roles. So thinking about knowledge, skills, and abilities that are needed to fulfill the roles, that all of the different roles that are needed within supply chain management. We also hope that this framework will elevate the status of the profession. It's a very, very critical profession and often gets undermined, as well as help to guide the conduct of supply chain specialists, as well as provide awareness to potential career paths. And then the final 2 points are important as well when, it facilitates recruitment, retention, as well as starts to develop the supply chain management leadership pipeline. And what this framework does, it brings all key stakeholders together and uses this framework as a tool to start to collaborate on this very important topic. Next slide, please. So just to let you know, at the core of this this framework is that we are providing a systematic way to build job descriptions, define supply chain roles, and align education and training with job requirements, thereby creating clear pathways for graduates. And so what's at the core of this are the specific supply chain management competencies that are necessary and are the overarching capacity to perform in an area. We break those down into specific behaviors that people can observe to be able to perform well in their jobs in the workplace. And so what we've highlighted within our framework and the competencies are, of course, those key critical supply chain functions when it comes to selection and quantification. So thinking about strategically sourcing medicines and health commodities, the procurement of those medicines, the appropriate storage and distribution and transportation of commodities, as well as, of course, the use and dispensing of medicines. And this is all encapsulated within thinking about how to do the resource management, ensuring that you are working closely to ensure that resources are available, as well as then the technology piece that we've spoken about, and then the personal competencies when we think about the soft skills. Next slide, please. And so what I wanted to highlight to you is that there are many things that education providers and employers can do to attract and prepare young people for a career in supply chain management. And what we've done is we've actually developed a work-based learning toolkit, and just wanted to describe to you what work-based learning means. It really is a strategy to then bridge the educational as well as the skills gap in health supply chain management by providing practical, hands-on experience. And so it integrates academic learning with job exploration, also looks at networking, career development, and helps individuals to understand the various professions that exist, but also helps them build professional relationships and develop then those key skills that are necessary for a long-term career in supply chain management. So when we think about work-based learning, that we have sort of three different categories. The number one is the very first one, so career exploration. And some activities under career exploration are those such as job shadowing, guest speaker sessions, and site visits to offer insights into the types of roles and daily operations that exist. The next category are those that fall within pre-professional development, so internships, apprenticeships, which are structured opportunities to gain that hands-on experience, and then apply what you've learned in class to then develop specific job skills under the guidance of very experienced professionals. And then the third category are those what we put under career development. So on-the-job training, skills workshops, professional networking opportunities to help individuals transition from education to full-time employment and help them progress in their careers. Let's see. Yeah, next slide, please. Thank you. So I'd like to also provide some practical tips for those entering the field of supply chain management. And this might help you sort of navigate your career path and make the most of opportunities in this very dynamic industry. So the first thing is the importance of building a strong professional network. Networking is essential in any career. And of course, supply chain management is not an exception. Building a robust professional network allows you to connect with industry experts, your peers, mentors, and of course, potential employers. You can start by adding industry events, webinars, and conferences. Just being here today is a start in this network, in building this professional network. Additionally, you can join professional associations. If you are a pharmacist, you can, think about joining an international society for pharmacists. And these can provide very valuable resources as well as the networking opportunities. But remember, building relationships is not just about who you know, but also about who knows you. So be proactive, engage in conversations, and offer value to your network. The other part is to stay updated with emerging trends. And so again, by being here, you've sort of picked up on some of the key innovations and trends that we're seeing for 2024. And of course, more into the future. As we know, landscape is, rapidly changing. And of course, these advancements that we're seeing, and we've spoken about this already, is changing consumer behavior, and of course, is affecting global economic shifts, especially when we're thinking about, the donor landscape as well. And then lastly, it's really important to think about online learning and certification programs. So glad that this lecture is going to be providing you CPD points, because you need these to also be building your skills and help develop your career. So as technology and practices, of course, evolve, continuous learning is very, very critical. And of course, there are numerous online platforms offering courses and certifications. And if you go back to our website and you look up the Supply Chain Management Professionalization Framework, Within our mapping of education component, we have highlighted over 250 courses that are available globally and locally to support your advancement in your career. So with that, I think let me pass it over to you again, Pam.
Right, and I can just add there that the Association for Supply Chain Management is also an internationally recognized body that offers various supply chain courses of international standards. Right, next slide, please. Right, so here I can tell you I'm delighted to share with you an award-winning initiative which was set up to empower young women in supply chain. If you take the next slide, please. Let me give you just a brief background. When I came back to Kenya and set up here in Kisumu, one of the things that I noticed was that we had so many young girls idle within the city area, especially in the evening hours. And I just wondered whether some of those girls could be educated in supply chain and have no jobs, have nothing to do. And we did a study with people that deliver, and I think this is where the whole thing opened up completely, where we were conducting a study on youth labor market. We did that globally, internationally, rather focusing on Africa, but then we zoomed into Kenya and Nigeria, and we learned quite a lot of the state of affairs with regards to the youth situation with employment. And what we found out was also that girls were more at risk, and majority of the girls were unemployed and falling into perhaps some bad behavior, not out of their choice or forced into early marriage. And we found out, we did that study, and then the Reproductive Health Supplies Coalition also had some focus on gender mainstreaming and really desire to empower youth under their laptop project. This laptop is a scholarship that awards scholarships to young aspiring individuals every year. And we have also seen some of those young girls go through that process. But through the Reproductive Health Supplies Coalition goal and seed funding, we were able to identify about some 36 girls to place them with employers within the Kisumu County, about 11 employers. What was the goal? I mean, the objective was to empower these young women to reduce youth unemployment, but also to professionalize supply chain, because look, we had girls who had done diploma and degree in supply chain, but had no jobs at all. If you're looking at the girls in front of you in this photo, that's just a drop in the ocean of some of the girls that had done supply chain, but had no jobs at all, had never worked. Everywhere they went knocking, employers were asking for some 5-10 years of experience, as if there was anyone who was born with experience. So we agreed here, partnered with the county government here, and identified 10 employers within the county and advertised for the girls to apply, and then also requested the employers to show up and open their doors to these young people. And we placed 36 girls across these 10 organizations. Mission for Essential Drugs was the one that took even more girls. Here in Kisumu and in Nairobi, we had the Acacia Hotel, we had Ciala Hotel, we have Aga Khan, we had Kisumu District Referral Hospital, we had quite a number of them, including PSA. We took some of these girls, and for 8 months, through the funding of reproductive health, they were able to get transport to and fro. That's all they were getting. But we were opening the door for them to go in and showcase, first, that they went to school, two, that they understand supply chain concepts, and wanted the opportunity to translate those concepts into action. And those who went there did so well. I don't know if there's a slide after this, but just click to see. Yeah, this is basically the mission of the project, to introduce female graduates to career opportunities, bridge the supply chain skills gap, increase female representation in the workforce and reduce youth unemployment among women. And let me say that by the end of the 8 months of internship, 13 girls got employed by the graduation day. The graduation was attended by the deputy governor here, representing the governor of Kisumu County, with the education minister and the youth, gender and sports minister here in Kisumu. And 13 girls got employed. I can tell you we did a follow-up later, 1 year after, and to date, 21 girls out of the ones that did not get the job immediately have gotten jobs. So we have 21 out of 36 girls getting job. That work-based learning that Dominique talked about, getting that opportunity to go and apply your knowledge. And if industry can work with institutions to allow for that simulation opportunity, employers will be able to spot some of those with potential, and not only girls, even the boys. Perhaps I'm biased because I'm a woman in supply chain, and supply chain has always been male dominated. But we also have young boys who really want to be involved in this. So at this point, we are scaling up this project. We want to hit 555. We call it, rather 500, we call it Vision 555. 5 means trying to scale up to reach 500 in 5 counties in 5 years. And that is the goal. And we are trying to partner. We are hoping to partner with Village Reach and looking for funding support from whoever is really keen to see us find jobs for these young people. Today, they are more confident. We really made sure they had developed high soft skills that they're able to stand by themselves. And I tell you, it's just remarkable as a mother, as a parent, seeing some of these young people transformed within 1 year gives me so much joy. So that's the Girls on the Move. And I'm sure there are other initiatives out there, but for me, the Girls on the Move has been a remarkable project where we've seen clearly that when you give these people opportunity, they'll get it. And let me also say that while we've still been looking for funding, we've had the employers come back to us saying that they need the same, more girls because they found that some of the girls were working well and better than the employees who are being paid salary. And that was testified by most of the employers around here. Kenton's was one of them. Kenton's is one of the pharmaceutical manufacturing company at the center of Kisumu here, who came to us and said they wanted more girls. And we've given them 2 more under a private funding. There's one lady known by Deborah Dahl who offered to fund, to sponsor 3 girls. So 2 girls are already with Kenton's. The 3 that we sent for the first time are already employees with him. And so he has 3 girls from Girls on the Move, put it that way. And that's just remarkable. So it's something that, to me, that work-based tool can really enable us to do much more if we can apply it. So we have here from the horse's mouth, Mercy Odhiambo, her own testimony there. Mercy says that this program enabled me to gain different skills and values through the training led by PSA. I gained much knowledge in the health supply chain, such as drug storage and dispatch, labeling, FIFO, etc. I was privileged to work in different sectors and currently in hospitality. This has allowed me to gain lots of experience in the supply chain. And here we have Hera currently working with Kenya Revenue Authority. We have others who have told their story. And what was interesting that this project was not only touching on their technical development, but some of the small amount that they used to receive, some of the girls would tell us that they had to spare it to buy their sanitary pads every month for those who are coming from male-headed family, either widower, who had people who are men who had lost their wives and had to bring up girls by themselves and buying them sanitary pads. They just said that they felt such relief to be able to do that by themselves. This is all about supply chain opening doors. And today, some of those, like Margaret Ochieng says that she's able to educate her siblings from the salary she gets. Not only can she look after herself, but to also support her family. So opening jobs is important for anyone who may be listening to me as an employer here. Institutions need to partner with industry to be able to create opportunity for these young graduates, men, young boys and girls, to be able to go in and apply the theoretical knowledge, translate it into practice, so that by the time they're going to knock at doors, they know what it really means to be in a workplace than when they don't know. And that's why I told you that some of them struggle so much when they go to workplace, and they can't, they look so lost, like someone who never did supply chain. And someone who does not even have a supply chain qualification is perhaps appearing to be better than them. So we need to do more as industry and institutions, but also opening doors for them for internship. I think there's one more slide, and then hand over to you. Maybe I've finished. Yes, over to you, Dominique.
Yeah, Pam. No, great always to see you so animated about this program. And I feel I contributed a little bit to it too.
Yes.
So I just wait. Sorry, Juliet. Just go back to the resources slide. Just wanted to highlight some of the key resources that we've spoken about in this lecture. So the SEM, Supply Chain Management Professionalization Framework, where you can find information about those 250 courses worldwide. And then this very new piece of work that we'll be publishing shortly. I can't say this week, probably next week, but it's all about the strategies for engaging the youth in supply chain management careers. And additionally, we'll be also publishing the work-based learning toolkit. I think with us having about 10 minutes left, I think Pam, I just wanted to, ask you a question, just again, sort of reiterate what we've spoken about here. And so my question then to you is, if I were to work for an educational institution, university, for instance, what can I do to better prepare my students for careers in health supply chain management? Because I truly believe that this is also at the core of the issues that we're seeing, especially when we're thinking about the local regional manufacturing, getting the workforce up to speed and ready to be able to manage that. We need universities to prepare them. So over to you.
Very important, Dominique. Number one, universities cannot continue teaching the same old curriculum that they've been using over the years. We talked of the shift in the landscape and the emerging trends. If I walk to Maseno University here today, will I find them aligning to the emerging trends or no? So curriculum development is key, and enhancing their programs will be critical. And then, of course, working with industry, as I've said, to ensure that students get some practical experience. How can they come to PSA here as an institution and tell me that students want attachment? Let me tell you, Dominique, that I also learned when we were trying to place girls in some institutions where they considered this as an attachment, not as a program. And some of those institutions wanted the students to be the ones to pay. Therefore, how can employers open their doors to some of these students as well when the industries send them for internship? And then skills development. You talked of skills, soft skills. I think you mentioned that. It's not only about technical skills, but also ensuring that students come out with soft skills in the bag. You mentioned certification and continuous development, part of what we are doing today here, which will earn them CPD points. So that for me is very, very important that industry take care of that. When you're talking of continuous development, you're talking of professionalization as gain. There is ASEM is there, and many other bodies that are offering professional qualifications. But I also have a question for you, Dominique. If I work for a public health supply chain organization, what can I do to better prepare my students for careers in health supply chain management?
Yes, very good question. So I would suggest that supply chain organizations implement some type of competency-based framework where they can then align career pathways, education, and professional growth within the organization. That's when you really start to support your supply chain workforce. And so, this kind of competency framework can then outline the skills and the knowledge and behaviors that are required within all the different types of roles that they need. I think it's also really important what we've spoken about already, just to summarize, is, there's the need to have sort of job rotations, stretch assignments that can expose employees to different roles and responsibilities within the supply chain. I think one of the things that I'm very excited about as well is, leveraging communities of practice where professionals can meet, where they can share common interests and share knowledge, discuss challenges, collaborate to discover all kinds of new solutions. I mean, you and I both have been very involved with the International Association of Public Health Logisticians for many years. That's a great example of a community of practice. But there are many more. That's just on a global level. We've seen now also the development of many local chapters in that. And then finally, I think it's really important or at least that organizations capitalize on digital learning platforms so that they invest in their own learning management systems, the LMSs, or some kind of digital platform that they can help their employees to keep building their skills through virtual training or collaborative learning opportunities, etc. Yeah.
Thanks very much. But I have one more question. And again, I've mentioned industry, I've mentioned institutions. When we talk about collaboration between different stakeholders as being important, and I know you agree with that, how do they begin a collaboration and what should they collaborate on?
Yeah, no, that's a great question. I mean, within the coalition, I'm all about bringing many different diverse stakeholders together to work on a collective program. And so this is an important question for me. But I think it's important to start to build partnerships across both government agencies, private sector entities, even like youth-led organizations, so that they can pool resources, knowing that the funding landscape is limited, but also pool expertise and perspectives, so that we can start to foster a collaborative environment. Because involving youth-led entities, offers very valuable insights into the youth demographic, what their needs are. It can help with sort of tailor effective and relevant programs. And so by establishing partnerships with industry bodies, we can provide access to subject matter experts, which is really important, from providing the mentors and coaches that we need, but also for training resources and opportunities for exchange of knowledge, as well as going back to that point around continuous learning. And so I think, let me just talk a little bit about the, developing structured mentorship programs, because I see that at a leadership level, we are very much working towards building mentorship programs, but as well for young professionals entering the profession, we need to also have structured mentorship programs. And so there is where the cross collaboration is necessary between industry leaders, academics, and even the government. So.
Great.
Yeah, and then my final question for you. Then we have 5 minutes left.
Okay.
Okay. What should supply chain management courses teach students that they aren't currently teaching?
Dominique, if there's anyone who was listening to us, I think right from the introduction to the last point you've made, we've actually basically talked about it all. I mean, I would say advanced technologies, talking of digital supply chains, analytics, big data, sustainability that I talked about, the ethical supply chain. Today we need resilient and risk management at any time. we need to teach our students on global supply chain management, because supply chain locally is affected by the global supply chain operations. We need soft skills and leadership, and then integrated supply chain strategies that will enable these young people to fit in the workplace. So I hope I've answered your question so that I can shut up and we hand over to Juliet.
Yeah, let's hand it over to Juliet now. Thank you.
Thank you.
Uh-huh.
Thank you.